On today's call, we're going to go over one of the things that I do with my clients over the phone, which is checking if their Medicare plan covers their prescription drugs that they're taking. And also something it's easy to learn just as a skill, because every annual enrollment period, you're going to need to check your formulary, whether it be baked into your Medicare Advantage plan or a standalone drug plan because you've got original Medicare with a Medicare supplement. Either route, you need to make sure that every year during annual enrollment period, which it's coming up October 15th to December 7th, you need to run your prescriptions that you're taking. If you're not taking any, then no action needed. But if you are taking some, run them through Medicare.gov. I'll show you how to do that now. Okay, here we are at Medicare.gov. If you hover over health and drug plans and you find health and drug plans, you'll need your zip code, obviously. We'll type that in, 72258. And for the purposes of this video, I'm going to show just using a Medicare drug plan, which is a Part D prescription drug plan. But how I teach you today, you'll also be able to use within your Part C policy as well, because Part C, most of the Part Cs, they do have a drug component in there. So you'll need to run your prescriptions through there. Won't be talking about Medigap today because Medigap doesn't have prescription coverage. That's why you need the standalone prescription drug plan. So we'll click into that. And here, this may apply to you or it may not apply to you, depending on what kind of extra help you get. I always like to say I don't get any help, just so I can get not what the program says that I might qualify for, but just to see the base drug price based on the plan and the offerings in my area. So I click that. Search preferences, yes, of course, we want to look up our medications. Okay, here's where the magic happens. So I'm just going to type in some of the things that I see a lot. Metformin, add, and you can mess with the quantity and the frequency, so we'll just leave it at that. And we'll maybe type in metoprolol. There you go. We'll add that guy. And what else? Maybe rosuvastatin. That's a good one. Add. All right. And let's throw in a curveball in there. Eliquis. Those who are on it, get it. You get the struggles. It's kind of an expensive one. Okay. So we've got our just a handful of medications, most common ones that I see done. And then this is where people, they miss it here, because this can alter the price of, and when I say price, I mean the co-pays that you pay monthly, and it could alter the results that you get. If you're not married to a pharmacy, meaning, no, Alyssa, I would rather pay more on my drug plan to make sure that I go to my local pharmacy, I'm okay with paying more. Then if that's not you, then we should put in multiple locations, and I'll tell you why. So here's, one Walmart, and it'll give me the closest Walmart. Then we're going to put in CVS. The reason why I'm telling y'all to do it this way is because all of these companies and their formularies, they kind of match like a puzzle piece with these pharmacies. So you want to see you want to see the most competitive plan in your area based on the pharmacy, based on the plans available in your area, and then based on that cross-referencing your medications. So it's going to automatically spit out and sort by the lowest drug plus premium costs. Now, it spat out this one by United Healthcare. It's got a monthly premium here. Your total drug and premium cost for the rest of, this is very key, right? I'm filming this in 2025, but soon, as soon as October 1st, they're going to release the 2026 plans. So make sure in the very beginning, after you type in your zip code, you toggle that you want to see 2026, because then it'll give you the outlook for the entire year. So make sure you're doing that, because then it'll say for 2026 here, and more than likely that would be higher. So if we go to plan details, I want y'all to pay very close attention as I scroll down. Yes, this is all great information, so on and so forth. Okay, we see that Walgreens and Walmart are preferred pharmacies of this plan, and that are spitting out the most competitive copays. Yes, CVS is a pharmacy that you can use. It's in network, but it is not preferred. Okay, you can see that you'll be paying lower copays compared to just an in-network pharmacy. But I'd like you to turn your attention to here, the estimated total monthly drug costs. Way back when, as in like 2 years ago, there was something called the donut hole, which that doesn't exist anymore. So don't worry about that, but you do want to be able to plan for the entire year. Now, some plans will absorb most of the plan's deductible. And you never know if we're looking at January through December, your drug prices may drop, the copays. You may have hit the level where you don't owe any copays for the rest of the year, and you'll be able to see that through your total monthly drug cost view here. So when you're doing your comparison, you want to scroll down to the estimated total monthly drug costs. So there's no surprises, but there are welcome surprises. Because what if this plan, you stop paying in the month of August, for example, and the other plans you continue to pay because that's the way the plan is built in per the formulary as well. So this is a great tool for you to use this upcoming enrollment period. But then also just to kind of make sure that you understand how to DIY it in case your agent, you can't get a hold of your agent, or in case you just want to do it yourself, which is totally okay. This is something, use Medicare.gov. It's got a great little calculator in there. And stay tuned for the next video. Let me see if I can. One thing I wanted to do before I let you go is show you GoodRx. Don't be afraid to use GoodRx. Even if you have insurance, for example, this medication here, I'm in the state of Texas where there is a lovely grocery store called H-E-B. Love H-E-B. Okay. Super fan of it, not only because obviously they have really good drug prices with GoodRx, but there's a great story. Anyways, use GoodRx. You don't always have to use your insurance, especially if you really don't take a lot of medications. There is a $2,000 max out of pocket to all prescription drug plans. Now, if you use things like GoodRx, whatever you pay, like if I use this $8.74 coupon, it would not go towards my drug plan's max out of pocket. So just keep that in mind. If you're taking a lot of medications and you're working towards that max out of pocket and you think you're going to hit it, you should stay and always use your prescription drug coverage. However, if you don't really take a lot, you're nowhere near the 2,000, and you just see that there's one medication that you have found a better price on something like GoodRx. This is not an endorsement for them. I don't get paid by them. I wish I did, because I can't tell you how many people I send to here. Sometimes using non-insurance options, and ask your pharmacist. They're usually the best people. They know of other drug savings plans. That, ask them if there is a way that you can knock off a little bit of drug copays on your prescriptions every time you fill. And if it saves you some money, you're welcome. But if it doesn't, it's just another good tool to have as you're going about your healthcare. So I really hope that helped. I will see y'all again the next video. Remember, annual enrollment period October 15th to December 7th. Gear up for it. It's a good time. Make sure you're keeping an eye on your mailbox if you ordered paperless, and so that means they're going to be emailing you any changes to your plan. It'll more than likely come at the end of September. So just keep an eye out and be aware of your plan. If you have a question, you can directly connect with me. There will be a link in the description below. Take care.